Nasogastric tube insertion. Verifies the physician's order for NGT insertion. Gather and prepares the equipments: stethoscope, dry cotton, sanitizer, cup, kidney tray, water, nasogastric tube, tongue depressor, tape, lubricant gel, NGT syringe, non-sterile gloves, incontinent sheet. Perform hand hygiene. Provide privacy. Greet the patient, introduce self. Confirm patient's identity using at least 2 ways: asking his name and check ID band. Explain the procedure to the patient, including what to expect and sensation he may experience. Emphasize that swallowing will be ease the tube's advancement. Assessment. Auscultate for bowel sound. Clean the stethoscope before using. Check the stethoscope if working or not. Place the diaphragm of the stethoscope over the right, lower quadrant of abdomen. Assess patient's abdomen for distension, pain and/or rigidity. Use pen light to inspect for a deviated septum or other abnormalities. Use dry cotton to assess the air flow in both nostrils. Choose better airflow. Or use finger to assess the airflow. Keep the patient in high Fowler position, 45 to 90 degree unless contraindicated. Keep cup of water ready. Keep tape ready for pointing the tube length and for fixing it. Perform hand hygiene again if needed and wear clean gloves. Put incontinent sheet over the patient's chest. Keep the tube ready or ask assistant to open it for you. Curve the tube. Determine the length of the tube. To be inserted to reach the stomach, hold the proximal end of the tube, beat the tip of patient's nose. Extend it to earlobe. Mark the point. Extend it down to xiphoid process. Be careful that the tube not touching the patient. Mark the distance on the tubing by tape. Curve the tube again if necessary. Lubricant the first 3-inch of the tube with lubricant gel. Instruct the patient to hold his head straight and upright. Carefully insert the tube in 2 more patent nostril. Aims the tube downward and toward the ear, advancing the tube slowly. When the tube reaches the nasopharynx, tell the patient to lower his head. Slightly rotates the tube 180 degrees toward the opposite nostril to redirect it. Use a tongue depressor to examine the mouth and throat for signs of coiled section of tubing. Use a pen light if needed. Offer the patient a cup of water with straw if need. If appropriate, and direct him to swallow slowly as you slowly advance tube into esophagus. Watch for signs of respiratory distress. Stop advancing the tube when the tape mark reaches the patient's nostril. Secure the NGT to patient's nose using a tape. Determine tube location by aspirating secretions and inspect the visual characteristic. Inject 10 to 20 air via NGT syringe and auscultate over left upper quadrant of abdomen. Cover the patient, keep him comfortable. Discard used supplies, remove gloves, and perform hand hygiene. Return equipments. Anticipate X-ray to verify the placement as doctor order. Documentation.